I'm Sarah Block, a nurse practitioner at SSM Health D Medical Group, OBGYN in Madison, Wisconsin. And I'm honored to speak in front of such a distinguished, albeit intimidating group. When asked to tell my stories, I was humbled to talk about what I and all of you do every day. Also, I do enjoy holding the attention of a room because I'm in the midst of raising two tween girls, and listening to their mom is not woke, and I'm being so extra. What you think are good things? It's not. Speaking of human connection, it's human nature to want to connect to people. In healthcare, we meet patients where they are. And many times, it's that compassion which is of utmost importance. We connect on purpose. Textbooks don't teach compassion. Sure, you can read about it, but compassion is something you all have inside of you. In some, it's hidden a bit deeper than others, but it's there. We all know I'm referring to surgeons, right? I'm joking. But in seriousness, try to remember when you made the decision to work in healthcare. Now bring yourself back to today. The combinations of pressures of production, patients who think Google is an adequate substitution for your medical degree, and the epic, all have a way of taking the wind out of your sails. And it can be easy to lose sight of the reason you decided to become a healthcare provider. But this conference is a time for us all to reconnect to our purpose, with that earliest desire to help and heal. I'm here to share a couple stories in hopes of reigniting that why. A year and a half ago, a family practice physician, Dr. Danielle Gindelsberger, and I implemented group prenatal care based on the evidence of studies showing extremely positive outcomes. We offer a modified version of the trademark centering pregnancy. And to meet the ACOG recommended number of prenatal visits, our patients attend a few traditional one-on-one physician appointments, as well as 6 group prenatal appointments, which include providers and pregnant women do it at the same month. We found this model is a great mix of the group experience and the benefits of one-on-one appointments with a physician. Before implementation, we toiled over curriculum, logistics, training, getting providers on board, which we all know is super easy to do. We built epic schedules and considered all of the what-ifs. Our type A personalities forced us to have contingency plans for all potential variables. Well, you know what they say about the best laid plans, right? Or a similar sentiment when a woman comes into labor and delivery with a very detailed birth plan. At any rate, within the first couple cohorts, we encountered 2 situations for which you cannot plan. First was a couple who had been desperately trying to conceive, and with the help of fertility specialists, and after a devastating miscarriage, they were pregnant and entering the 2nd trimester. They attended the first 2 groups at 12 weeks and then 16 weeks. In between the 2nd and 3rd group is a traditional one-on-one physician appointment. Things were going as well as could be expected. Then, just when the mother entered her 24th week gestation and was able to breathe a little more deeply, she experienced spontaneous preterm premature rupture of membranes. She was admitted to the hospital to be monitored and given antibiotics, magnesium sulfate for fetal neuroprotection, all sorts of precautions. Since she was in the hospital, she was unable to attend the next group prenatal appointment. Even though she and her husband had only attended 2 group appointments, they felt a connection with the other participants and asked to Skype into the group appointment. With a tremendous amount of collaboration with about 15 different departments, we were able to get everything set up, and she and her husband Skyped into the appointment. This patient gave the most eloquent explanation of what happened, the plan moving forward, the great care she was receiving at the hospital, and how she and her husband were dealing with everything. The group members asked questions and conveyed their well wishes. The support was palpable. The very next day, the mother went into hard and fast labor and delivered a baby girl vaginally in the breech position within about a half an hour. The baby was taken to the NICU, and within a few short hours, she was stable. The baby girl, who weighed 1 pound 9 ounces at birth, was making strides every day. At the next group appointment 4 weeks later, I checked in with the patient, and although she didn't think she could Skype into the appointment, she wanted to write a letter to the group with an update. As I read the letter, many of the group members began crying as they had hoped they'd hear the pregnancy was continuing. Then, 2 weeks later, almost as suddenly as the baby entered this world, she developed late-onset group B strep infection and passed away in her mother's arms. I was given permission by the parents to share the devastating news to the prenatal group. As you can imagine, this was received with tears and what can we do to help? The compassion of the group was strong, and while they couldn't take away the pain of these bereaved parents, they were able to join in supporting them through the unimaginable. Through facilitated group prenatal appointments, these people who were strangers 4 months prior have become a small, close-knit community. As an update, she is currently pregnant, this mom, and over 32 weeks along in gestation. The second scenario involves a woman who had gone through the process of selecting a sperm donor, intrauterine insemination. She did not have a partner, which made her a perfect candidate for group prenatal care. Her prenatal group became her support system. With each group appointment, you could see the bonds growing stronger. And at 31 weeks pregnant, she was hit by a car. Seriously, she was hit by a car that was going 25 miles an hour while she was walking her dog in a crosswalk wearing a reflective vest. She endured multiple pelvic fractures and a broken leg, spent a couple of weeks in the hospital for monitoring. The group sent flowers to the hospital as a sign of support. Then, miraculously, she came to the next group appointment. By this time, she had graduated from a wheelchair to a walker. We brought a recliner into the room, we propped her up with pillows, we hooked her up with a fetal monitor for her weekly non-stress test, and we even gave her juice with a straw. While she was on the monitor, she told the story and discussed the hospital and labor and delivery department and how great the staff and doctors are. She shared her experience with the others as a means of returning the support she had received from the group. She ended up delivering a healthy baby boy via C-section at 38 weeks. Both are doing very well. Connecting on purpose takes effort. It's implementing group prenatal appointments because you know patients will benefit. But also, it's small gestures, such as setting up Skype to keep group members involved, sending flowers, or placing a straw on a can of juice. It's human nature to want to connect to others, and the benefits very much outweigh the effort. When you take time to remember the why you went into healthcare, when you reconnect with that earliest desire to help and heal and recognize the real impact we can have on people's lives, your mental health improves. The relationship with your coworkers improves. You're not as depleted by the end of the day, which means your family reaps the benefits. And most importantly, our patients know someone cares. Thank you.